vagus nerve. 11, accessory nerve. Okay, accessory nerve. And then 12, hypoglossal under the tongue. Okay, so just kind of, this is in the lab. You need to identify, if we point, which one is this. So draw yourself a diagram or something. Just got to remember where they are, okay? So, let's see if it's here. Okay, it is here. So you gotta memorize this as well, okay? 1, 2, and 8 is only for sensory. 3, 4, 6, 11, 12. It's for motor only. And the rest is mixed. 5, 7, 9, 10 is all mixed nerve. Okay? So just gotta remember how, just gotta find a way to remember, okay? 1, 2, 8. So 1, 2, I guess you can do 1, just 2 is the eye, and then 8 right across is the ear. 1, 2, 8 is all sensory, so that's so you could feel things. Okay. 3, 4, 6 is movement of the eye. 11 is moving of the shoulder, and then 12 is moving of the tongue. So that would be motor. So if you read this, it's all about moving. And then mix, it's got both sensory and motor. Again, here's the spinous process. We can see that it's bifurcated. So it is a cervical spine. It's got these foramens. Okay. So this is a cervical spine. You have 31 pairs of spinal nerves. Spinal nerve innervates the peripheral. So here's the spinal nerve. It innervates the peripheral nerve. So these are called plexus. Plexus are network of nerves. So coming out from the neck will be cervical plexus. Coming out of the lumbar, going down to the legs, will be your lumbar plexus. So here are how it kind of innervate. Okay, when we do a test, having somebody close their eyes, we can actually sense whether they're feeling it or not. We can tell which spinal nerve has problems based on if they're feeling it or not. This one, I believe you have to, so this is very simplified, okay, but you have to know some of the brachial plexus, okay, brachial plexus, okay, axillary nerve, radial nerve, musculocutaneous, ulnar, and median nerve. Just kind of memorize it, okay, axillary nerve, shoulder. Radial nerve goes to the posterior arm and forearm. Musculocutaneous, anterior arm, and radial surface of the forearm. So, so read through it. Okay, axillary. Let me see if I can turn this. It's your shoulder. Okay, the radial nerve is the posterior arm and forearm. Okay, where's the posterior? It's the back of the hand. Okay. Musculocutaneous is the anterior arm and the radial surface. Where is the radius? Radius would be finding the thumb. Here's the radius. Radius. Okay. Ulnar. The ulnar nerve. anterior forearm muscle, ulnar side of the hand, and the median nerve, anterior forearm and the intrinsic hand, radial side of the hand. The lumbar plexus, you got your obturator nerve, the femoral nerve, saphenous, the sacral plexus is your tibial nerve, common fibular nerve, and your sciatic nerve. Okay? So, just got to try to remember them. So, pretty easy for lumbars, only got 2 of them. Obturator, remember the obturator foramen is that hole. Okay? Obturator foramen. And the femoral nerve, okay, that big one. Sacral plexus would be in the back. You got the sciatic nerve, which is the big one. Okay. The common fibular nerve is on the outside of the fibula. Okay. Tibial nerve is in the front, where your tibia is. Okay. So, just got to read through it, and then if you have any problem, just ask me in class. The brain, the cross section of the brain is pretty confusing. You just gotta try to remember all the landmarks, where it is, like the lobes. Part of the Broca's area we talked about, the Wernicke's, like the Broca, Wernicke's, and know your hypothalamus, your thalamus. Okay. Know all these: optic chiasm, pituitary, and the pineal gland. Okay. Of course, you got to know the midbrain, the pons, and the medulla, and then the cerebellum here, and the tree of life. Okay. Arbor vitae. You got to know your corpus callosum, your ventricles. Okay. Lateral ventricles, and then the 3rd ventricle, and then the 4th ventricle here. You gotta know your horns. Posterior, anterior horn. Posterior is for motor, anterior is for sensory. Ganglia. Okay, know the 3 meninges. Okay, 3 meninges. You got to know the spinal cord, the spinal nerves. Okay, gotta know where they are. And your plexus. Okay, your plexus. Okay, I will see you for chapter 14 next time.